Welcome, everyone. I'm Joe Kolars, and I lead our Center for Global Health Equity here at the University of Michigan. This involves our entire campus. We're in our third year. We're really committed to better collaboration for better impact in global health. And our seminary series this year, we're just kicking off today. And it's the whole concept of climate vulnerability in health and how are we responding? It seems like that there's a lot of attention that's going in to a problem statement, which we need to amplify. But can we learn some lessons about how we should be responding with today's focus on the impact of extreme heat? In our center, we have a number of communities of practice, and we have a climate vulnerability challenge group that operates with faculty and students and learners from across our university. And we're always looking for best partnerships. I have to say that Aga Khan University is one of our top and leading collaborators right now, based out of Pakistan, but multiple campuses over in the East and Mid-East. On today's conversation, we have 380 people registered, including 100 people from Pakistan. And so a special welcome to those of you who are tuning in from Pakistan. We know it's late Friday evening, and you wouldn't find many of our students tuning into things on a late Friday evening. But welcome to all the faculty, staff, students, alumni. Also would like to thank our co-sponsor, Office of Global Public Health. We have a leading school of public health here, our International Institute, and the Taubman College of Architecture. And we're going to be hearing from two speakers, Larissa Larsen, who's a professor of urban and regional planning here at the University of Michigan, and from Professor Jai Das, who is an assistant professor in pediatrics and child assessment, but he's very active in the Aga Khan's Institute for Global Health and Development. So somebody we can all learn a great deal from. And who's going to be facilitating this conversation today is our own Marie O'Neill, who's professor of environmental and health sciences and epidemiology, who has done a lot of research in this and related topics. So we're looking forward to the presentations and particularly to the conversation it generates. And Marie, let me turn things over to you.
Thank you so much, Dr. Kolars, and it's really a pleasure to be here today, and welcome to all of our remote audience from near and far. So let me start by providing a little bit of the big picture. So within the United States, the American Public Health Association has stated that structural determinants of health and climate change are the key defining health challenges of this century. And the World Health Organization has described climate change as the biggest health threat facing humanity. And I think we've all seen between wildfires, floods, heat, and other events that climate-related exposures and climate refugees, displacement of populations are truly a really important global as well as local health issue. So the reason why extreme heat is of interest is all of the models, the Intergovernmental Panel on Climate Change, national models have shown that heat waves are increasing in frequency, intensity, and duration. And we're also seeing differences in the variability of weather across the globe. And the health impacts of exposure to extreme heat as well as climate variability are numerous. Mortality, illness, there's evidence that heat can be associated with low birth weight, with preterm birth, other kinds of adverse birth outcomes. And we also know that heat is a big health equity issue, and we see these impacts in hundreds, if not thousands, of studies, both within communities and across broader demographic groups and internationally. So I'm an epidemiologist, and with my collaborators, we work on research with the intention of informing policies to take action. And these policies can range from regulations to shaping urban planning for identifying priority populations for intervention. And I'm really glad to say that Larissa Larsen, who will introduce, is an urban planner, and Jai Das is a physician. And I think there's no way that we as a society and a world can come up with solutions for the issues of climate change and health without multidisciplinary collaborations, which include collaborations from community members who are experts on their own particular situation. And I think the possible solutions that we like to focus on include adaptation to what is already occurring in terms of climate change, thinking about how we build cities, how we homes to protect ourselves from climate extremes, and then also societal choices such as putting in vegetation and making decisions that are both beneficial for reducing greenhouse gas emissions as well as beneficial to human health, equity, and well-being. So because there's such a range of health impacts, and my colleagues will talk a little bit about solutions, and Dr. Das will talk about maternal and child health, I just wanted to highlight one particular global health issue, and this is a figure from a recent review article having to do with heat stress and farm worker health. And, there are a few studies, but it's becoming really a huge issue where heat does impact farm workers' health as well as probably interacts with some of the pesticides and other products that are used. And the next slide talks a bit about the epidemic of chronic kidney disease of non-traditional causes in Central America. This has also been called Mesoamerican nephropathy, and there's an emerging interest in looking at this epidemic of kidney disease among young adults. And I want to acknowledge my colleagues Alexis Handel and Lisbeth Iglesias Rios, who provided these slides, and also to highlight the issue that global health is also local health. Doctors Iglesias and Handel have started a Michigan farm worker project, and the farm workers in Michigan are migrant workers for the most part from Central America and Mexico. And Dr. Iglesias has just received funding to look as a focus on heat stress and health among this cohort of farm workers. And notably, this is a community-based participatory research project where we have local partners. So I think part of the Center for Global Health Equity focus has really been on thinking about equity, and equity that includes equal partnerships between academics who study health impacts of climate-related exposures and climate change, urban planners, others, and people who live in the communities and are the ones who have the wisdom to shape our solutions. So with that, I want to thank you all, and I will next introduce Dr. Das, who will be the next presenter. He's an assistant professor in the Department of Pediatrics and Child Health at the Aga Khan University in Karachi, Pakistan, and his research interests include interventions to address maternal and child nutrition and infection, as well as designing interventions to help manage the health effects of heat. So thank you, Dr. Das.
So thank you, Marie, for the nice introduction, and thank you to the University of Michigan teams for providing me this opportunity. So I'll be talking briefly on how to design and evaluate interventions which could help manage the health effects of heat, especially in the developing countries context. And before going any further, so this is a very well-known phenomenon now that global temperatures are rising, and most of this is due to the human influence rather than any natural causes. So, and you could see in the last 2 or 3 decades, the rate of increase has been escalating, which is worrisome. And a common person in any context you can ask, they can feel this change, and this is so obvious now. And so more needs to be done to see what could be done in the short to medium term time range to mitigate the effects, especially effects of the region that I come from, the Southeast Asia. We see roughly a quarter of the world's population lives here. And because of the terrain, you can see, and in the geography and the weather, you could see this is one of the area in this whole world which is the most affected because of these changes. The impact of heat are multifold on health. Some of these effects are direct effects, some of them are indirect effects, and affect many systems across the body and also the health systems. And unfortunately, again, the most vulnerable are the populations which are most affected. These include children, elderly, displaced, homeless, pregnant, outdoor workers. So these populations are the ones who bear the brunt of this climate change effects. We dwelt into this area of climate change around a couple of years back. And I think any scientist who's working in this area has to work in this because such a pressing issue globally. And so, as usual, we started looking at what exists to increase our knowledge and also to see what could be replicated in a setting of Pakistan. So we did a systematic review looking at what exists. We found many reviews looking at the impact of various climate hazards and their impact on multiple health outcomes involving various systems. So this is known that all of these climate change hazards have effects on various health outcomes. Then we started to look at what are the possible solutions, what have people done, and what have they proposed, what could be done in a setting of like ours. And unfortunately, what we found, in contrast to those associations, there were very few interventions which have been tested to mitigate the effects of climate change on health. And more importantly, when we further saw, and as Murray also shared in a slide, most of this evidence is coming from high-income countries. So there's a huge gap on how developing countries could adapt the interventions that they could choose to avoid the effect of especially extreme heat on health outcomes. Most of the evidence that came across revolved around air conditioning, which is more importantly coming out from high-income countries. Although it does protect against adverse health effects, it improves work productivity. But many of its factors, first, it contributes to the greenhouse gas emissions and leads to increased temperatures. But more importantly, in our setting, this is something which is not plausible and feasible because there are shortages of electric supplies. And secondly, the costs involved with this is something that cannot be proposed as an intervention in the setting of a developing country. But having said so, it doesn't mean that there aren't possible solutions. There are solutions, some of those which have been there, some of those are simple, some of these needs a lot of behavioral change and structural changes. And broadly classifying those interventions could be landscape level, building level, and individual level. This could include greening and plantation, using different pavement materials, especially in urban contexts, water bodies and misting, providing shading infrastructure. At the building level, there could be adaptation from the regular concrete roof and wall materials, providing window shading and ventilation. At the human level, it could be behavioral change, work rest schedules, warning systems. So all of this could be implemented to have an effect on health. And this is just a view of an urban city of a developing country. Karachi, you can see it's a concrete jungle now. You would hardly spot any green patches here. We also looked at how these structural changes could have an effect. So we looked at various modified pavement materials, including modified asphalt, coatings, pavers, and the systematic review that we did showed that this did have an effect on reducing the temperatures. We also looked at how these green roofs, walls, or facades could have an effect on reducing the temperatures. And a meta-analysis showed that this does have an effect, although studies are showing a varying degree of effect on the indoor temperatures. These are the traditional structures in rural areas, which are built from materials that are low cost, available, and provide a lower temperature inside. So apart from the systematic review and looking at the effect of various materials on reducing the temperatures, we also started this project, which is based in 5 countries in South Central Asia, in East Africa. And This basically is aiming at doing those country case studies, and this involves developing in-country think tanks and mostly relying on available data. This available data could be in the form of quantitative data, or what are the policies and programs that have been implemented within those contexts, and what do this suggest if there have been any evaluations of those programs. Also to use secondary data of health and getting secondary data of weather, climate data, and interpolating them to see whether climate change have ever had an effect on health outcomes, and if so, what are the particular pockets within those countries which had had the maximum effect. And the idea is that based on this data analysis, on their own expertise, they can suggest local context-specific solutions and identify areas that should be a priority for those contexts. So this is something that's also ongoing, and maybe within a year or so, we should have some meaningful outputs from this exercise. So with this, we also, apart from this, doing the systematic review and looking at existing data and getting help from experts within those contexts, we are also planning to start a study. This would be a randomized controlled trial, which we would implement in both a peri-urban context and a rural context of Pakistan. And this is basically looking at evaluating various interventions which could be adopted to mitigate the effects of extreme heat in peri-urban and rural settings. And as we have shown with various different health interventions, that empowering community and bringing them in the fold can have escalating effects. So the strategies that we are proposing as part of these interventions include various things. It is a composite of various interventions, including early warning systems, community reorganization, grouping, education and awareness, together with structural and lifestyle changes. These warning systems involve forecasting, predicting, triggering response, notification, and more importantly, communication at the right time. And the educational package, as I previously said, is a multitude of various interventions at various levels, starting from education, awareness, personal cooling interventions, and more importantly, participatory local structural and environmental changes that could be done at the building structural individual level, which could have an effect on reducing the temperatures in the environment that they live in, and also more possibly have an effect on health outcomes. And this is proposed to incentivize where the funding would be shared by the community groups themselves. We are still in the formative phase in which we're talking to the stakeholders to see what is possible, what are the structural changes that they are ready to adapt. And once that's done, then we are going to evaluate the effect of these interventions and also looking at the health outcomes. And health outcomes vary from temperatures to physiological outcomes to concrete morbidity, mortality, and also the effect on activity and sleep duration. So this is something that we shall soon be starting and would see whether these interventions have an actual impact on the populations at large. So I'll just sum up the work that we've done so far and more importantly in the couple of years from now. And what we have seen is that there is a dearth of evidence looking at the interventions, especially in the developing countries context. And there is a need to evaluate these interventions in the specific context, and especially looking at the effects on the most vulnerable populations. So thank you, and over to you.
Thank you so much, Dr. Das. That was really a great overview, and I want to encourage the audience to put questions in the Q&A so we can discuss further. But I'd like now to introduce Professor Larissa Larsen, who's a professor of urban and regional planning here at the University of Michigan. Her research focuses on urban environmental problems, including extreme heat, urban heat islands, water pollution, and infrastructure and stormwater flooding. Over to you, Larissa.
Thanks so much, Marie. I'm very pleased to be here, and I think that was a really great presentation. And some of the things I'll try not to repeat, provide some different things. So as an urban planner, my experience is mostly in East Africa. Working in these cities, we see a lot of unplanned urban development, weak governance, and challenges around ecosystem decline. These are all huge problems. And then we add extreme heat onto these things. Our responses, and these are very broad, deal with settlement upgrading, land access, thinking how we can provide infrastructure. I'm very interested in water and wastewater, strengthening livelihoods to address the poverty issue, ecosystem protection, and then the world of microfinance and insurance. We're learning more and more, again, about the importance of that in addressing poverty. So those are some of the broad things, but yet we have this complex problem. So hopefully you can see some images of Addis Ababa. This is a place that lots of University of Michigan people have been to because we have extensive contacts with many different organizations here and universities. And so you can see this shows the example of low-density development, which is really a huge problem for thinking about transportation, providing it through an extensive network, and then the challenge of infrastructure services. You can see in the center in Addis, we have a lot of informal housing. Some of it is considered slum housing because of the poor materials and the lack of protection it provides for people. We see it throughout the city. And then we have the government has started a very new, interesting project to try and develop housing. Unfortunately, most of it is around the edge of the city. Again, transportation being an issue, and they refer to it as condominium housing. This just shows, again, on the left, some informal housing, people doing their best. One of the interesting things I found is informal housing is not temporary housing. This is forever housing for many people. And the maps on the right just show a project I worked on with faculty at Addis Ababa University. The clay color in the map is where the informal settlement is located. And you can see over the last, the 10 years we mapped, that it becomes much more diverse throughout the city. It's not just along the river, which it was on the top. And then the red to the right is where the new condominium development is located. So what do we do about this? Well, as an urban planner, we try to think about these infrastructure systems. You can see below the problem with surface water pollution is an issue, and the quality of the water throughout the city is really degraded. And unfortunately, in the bottom left, you see people using it to irrigate crops there that they will depend on to provide local vegetables. We also have the issue of the dimension of equity. One of the things is around water access and purchasing water. And so one of the things I've been learning through heat is water is just the incredibly important part of that. And so how do we make sure that people have access to that? And we know very well with the projections we're seeing that water is increasingly scarce in these locations where we see precipitation patterns changing. This is just an overview, and I won't make you read this, but what I want to call your attention to is another thing that I'm learning about. And that's really, it's not just thinking about temperature and indoor temperature, which I'm thinking quite a lot about, but it's also air pollution and the air chemistry that relates to that. And certainly that's an area Marie is very familiar with. And so I think as in my research going forward, I'm not only concerned with how hot is it getting, how hot for how long, but also to the quality of that air. What can we do from a city perspective or a planning perspective? Well, Dr. Doss highlighted many of the good practices that are out there, and I'll just kind of speak to a few more of those in detail. Probably Stuttgart, Germany is the place that does the best sort of city-level planning around heat, believe it or not. And one of the things that they've done for a long time is think about ventilation corridors. This is also happening in some of the cities in Japan, where we're really trying to think about elevation change, naturally occurring wind patterns, and ensuring that development doesn't block those. Other things we know also too are the problem of waste in cities. And so we see in many lower income cities the presence of cars. And can we start to think about reducing that and locating facilities downwind of residential so that the waste heat doesn't create more problems? One thing that's interesting here is we're starting to talk about how do we raise attention to these issues. As Dr. Doss said, awareness, education is important. There's a movement afoot to actually name heat waves so that they become something like hurricanes, that they are a memorable event and they're not diminished in their importance as just something that you can get used to or survive without recognizing the sort of total impact. At the neighborhood level, We see certainly the importance of resident engagement, as Marie nicely highlighted, using vegetation. But I'm going to come back to this. This is water again. Now, this is vegetation in the pictures being added in Addis Ababa. But again, that tanker is water. And for all people, that is not easily accessible. We also have the inequitable distribution of urban green spaces. And can we think in this country and higher income countries, we're talking about cooling centers. Perhaps are we thinking here more communal interior courtyards that we could use? Okay. Finally, at the building level, which is really, I think, some of my interest is, once we prioritize where in the city are these concerns, the very, very best sort of approach to this is shading. I've said a couple of times, trees are terrific. I love trees, but they do take water, they do take space and maintenance and care. So I also hope we're thinking about simple things like overhangs and shade structures. In these settings where electricity is always not present, I think looking at some of the strategies to do with solar powering could be really useful. And so can we have solar-powered systems that provide some cross-ventilation in homes? Particularly, I'm thinking in informal homes. Can we use ideas of stacked ventilation, where, again, we're just using basic principles of air movement to help provide sort of increased comfort? There's also some really, really interesting new materials coming out called phase change materials. And when they change from a gas to a liquid or from a liquid to a solid, they really can retain quite a lot of heat. And so I think that some of these materials are going to be really worth investigating. Also linked to, Dr. Doss mentioned, we can't just rely on air conditioning. We absolutely can't, because of the fact that most of the electricity is generated by fossil fuels in most places. But there are some new systems coming that use non-polluting salt solutions and are much, much more efficient. So again, if we can couple sources of renewable power like solar with batteries and then some of these simple technologies, I think that that would be extremely helpful. Finally, what do I think about these things? Well, we know that there's some people call the research divide the 10-90. About 10% of research is happening in lower income countries and about 90% in higher income countries. We need to kind of flip that. And the Global Health Equity Center is, I think, very much recognizing this problem. I'm also trying to be mindful of air pollution as well as indoor heat, and just stressing that we've really got to be careful that our strategies aren't all reliant on water, because that's going to be, as some people say, it's the linchpin of climate change. Thinking about interventions at different scales is important, and I think that's something maybe urban planners can bring. So we should have city-level strategies as well as neighborhood and structure, and also additionally, certainly individual level. But planning, I guess I would say we're very much interested in the neighborhood and the structure level, and working collaboratively with local academics and residents. These are just a few pictures. The UMAPS program, the University of Michigan Presidential Scholars Program, has been a terrific one for increasing engagement. And I hope to pursue a project actually in Nairobi, Kenya, in the Kibera informal housing district with a former Michigan UMAP scholar. So again, anytime we can collaborate and learn from each other, I think that's really where we want to go. And testing interventions, I think, is really critical. I'll just highlight this. I'm not part of this project, but I think it's an excellent one where we've got different people collaborating from the University of Michigan, from planning and architecture, engineering, social work, public health. Maria is involved with this, as well as Karina Grunland at the Institute for Social Research, and our Office of Research on Campus is looking at doing a collaborative kind of some place-based interventions where in these 3 city locations, we want to work with communities to understand they want to work with communities to understand what things really will be the most effective in place. Because again, we want to kind of couple some of what we're learning about materials and strategies, but if they don't work properly in the places with the people, they're not going to be too successful. So I'm going to be watching this project with great interest because, again, I think we can learn a lot if we start testing some interventions in place. Again, I apologize for some technical problems and a bit of noise, but thanks very much, and I look forward to some of the ideas and questions that emerge.
Thank you so much, Dr. Larsen and Dr. Dawson. Really thought those were great talks, and we are now able to answer some of the questions that our audience has put in the chat. So some really excellent ones. I will start in the order received. We have a medical student at the University of Michigan who had a question for Dr. Das. She specifically says, I spent my last year in India completing research on climate change and nutrition transition among farmers. Would you talk more about what your study found about climate change and nutritional impacts?
So thank you. I think this is a great question. And so we haven't specifically found anything looking at the impact of direct impact of heat stress on nutritional outcomes. But what we have seen, what we've read literature, and even from the formative work that we have done talking to farmers, it did have a great effect on agriculture, and especially in countries which are already food insecure. All of these heat effects, the floods that we are facing, they add to the already malnourished populations that we have. So I think it's an important area that, like any other area, would need further research to see. There is work going on looking at how climate resilient agriculture could be promoted. What are the strategies that could be adopted at the agriculture level? So I think a very, very important area, especially in our context, and more evidence is required to see what are the pathways of the effect of heat stress on nutritional outcomes, so that specific interventions could be designed to target those pathways.
I can just jump in. This is sort of some research from, again, North America. And so they're finding for every increase of 1 degree, corn production is decreased by 6%. And so I think we're starting to see, again, there's a disproportionate impact on productivity and yield as a result of each of these degrees. So it's pretty remarkable, actually.
And if I may add, also, apart from this changing temperature or rising temperature, the changing seasons are also affecting the agriculture yield, and farmers are confused where to sow the seeds. And the rainfall patterns are also changing. So all of this cumulative, apart from this rising temperature, are having a great effect on agriculture.
Thank you so much. The next question comes from one of your colleagues at Aga Khan, Basil Musharraf. And the first part of the question had to do with, I think, the comments about greenery as kind of a mitigation and a beneficial action regarding climate change and human health. And he says, when campaigns and studies talk about urban greenery, most people think about grass. However, when it comes to climate change, and grass is something that does more harm than a lot of things, it's misleading. It's disguised as a beneficial thing. Can you please shed light on if work has been done or is being done on this, and how aware the population at large is regarding this? So I'll just start with the comment. I think it's a really great point. There's a really growing literature in epidemiology that utilizes satellite imagery of land cover and green space, and numerous beneficial associations with health have been seen, from mental health outcomes to birth outcomes, higher birth weight babies among women with more access to green space. But I think the point is excellent, that grass is not the same as a tree that shades. Larissa talked about the need for water. And so I think that these larger scale studies using secondary data are useful, but there also needs to be accompaniment with what are interventions that are effective, cost-effective. Trees don't grow overnight and things like that. So I think it's a great point. I invite the other colleagues to say something about this. And then I'll also just mention there was a second question for you, Dr. Das, about whether heat action plans have a significant impact? That is a challenging question, and I will turn it over to you.
Right. So great questions. Absolutely right. So regarding the awareness of the communities about this green is lacking, and especially if you talk about our context, and as I've shown the picture, even the green spaces that we had, we don't see it anymore because of various interest of a particular people, especially people in the building sectors. So they are occupying all of those lands and we don't see anything, and there's a greater lack of awareness in the community. So you are right that there is a need to increase the awareness, especially what does this green spaces mean? And it's just not focusing on grass. This aspect of knowledge is missing in the communities, and what works, what doesn't work. At least I don't have an answer to this, because I think that there is no concrete evidence to see what is exactly. But there have been studies, but mostly they are from retrospectives data, looking at satellite data, temperatures that we separate data collected for health outcomes. But even within those, if you have those climate data, the context of every person and the exposure that he has within those households, the temperature that any person experiences, varies so much. So I think a lot of actual data, prospective data, individual level data, primary data is required to have some specific answers. But I think these all are so important issues that need to be explored. Regarding those heat action plans, whether they work or don't work, I don't have any concrete scientific study to show that. But just an example of our city in Karachi, you can see in the year 2015, there was a heat wave. People of Karachi weren't aware of that, and there were many deaths in that year. But after that, there have been a couple of other heat waves, but people are better prepared because they know, and there are more awareness and alarming signs and awareness activities from the government itself. So you do see, as an anecdotal experience, I can see that there are not much morbidities and mortalities as we saw in the year 2015.
I'll just jump in and speak a little bit more to the tree issue. It's, again, grass is not as effective. I've looked at some studies in South Korea, and we want to shade first. So the trees are much more effective. But we want to think about what trees we use, exotics versus native plants. In Ethiopia and Addis, they have an awful lot of eucalyptus. It's an exotic plant, but it takes a lot of water, and it's actually drawing down the aquifer under the city by that. So I think it's not only, can we plant trees, where we can plant them, but what kind of plants. And also, if you look at some of the satellite research that Marie was referring to, impervious surface is a huge driver.
Thank you so much. And we have a flood of excellent questions and comments in the chat. One from one of our MPH graduates. Are there concerns related to funding climate change related mitigation research efforts in the LMICs? And I think Larissa's 1090 point addresses that, but I invite the panelists to comment.
I guess this is related to the funding opportunities. And I think this is increasing, and you would see so many calls now, and every agency, every funder is interested. So I think the opportunities are there, and they are increasing and would increase. So opportunities are there to grab this funding and to do research in this.
I think one of the things we really need, though, is sharing out interventions, like Dr. Das is trying to do think tanks in different countries, and some standardization in how we're testing and using the metrics. I mean, where are we locating, are we using indoor wet bulbs, thermometers? Where are we locating these? How are we conducting it? So we can start to do cross-country and cross-city comparisons. I think there's really a lot of value in doing that.
Thank you. So another question is, when discussing possible solutions for extreme heat, are there additional considerations or different solutions for events with high heat and humidity, wet bulb temperature events? And I'll just comment, yes, we know from personal experience that the dry heat is more comfortable because we're better able to perspire. So the humidity is a great concern. We have to think about that with studies where people can adapt to the prevailing weather and climate conditions in their area. And so we have to think about humidity, and also with climate change, we also are seeing more evaporation and higher amounts of humidity in the air when it gets extra hot. And there are also some kinds of air conditioning, like swamp coolers, that may not work well in a highly humid environment. So that's just one comment about that. Others want to add anything, feel free.
Yes, I'll just say that, we need to think about measures that combine sort of the what is the actual temperature and what is the sensation, or what is the human impact of it. So it's like these thermal comfort indices that they have developed. So we know, it's not just temperature alone. And so some of these measures help sort of correct for that addition of, is it humid, is it dry?
I think one of the questions might be a good one to end on, and this is from architect Carney from an architecture firm in Pakistan. Both of the other panelists, what are some promising strategies or interventions for preventing heat-related illnesses and protecting public health during extreme events? Do you have any examples of case studies that you can share to get an idea that designers could consider for sustainable design? And I do want to, before I turn it over, I think the project that Larissa alluded to that's underway here with global cooperation looking at passive cooling, that really directly addresses the point Dr. Das made, that the solution here is not to install air conditioning all over the world. That, in fact, is a counterintuitive one. And so I think that there's a real role for designers, and where we live is where we spend most of our time indoors. So I think that's really a highlight, that we want the architects and engineers and builders with the technical solutions to be part of this. So I invite you all to give any case studies or examples as a way of kind of wrapping this up.
There are many architects, even in our geography, who are working on this. And if you talk about architecture, it varies. It is different for both urban and rural areas. So they're finding different solutions for rural areas and different for urban areas. This could include like reflective painting on the roofs and wind catches in the buildings and different architectural building facades, or there's Mughal architecture, because that allows air to ventilate in, and there's cross ventilation. So I think work is going on. There are multiple case studies that you can allude to. And even in India, there have been various different interventions, local interventions that they have tested, which have shown reduction of those temperatures. So there are local examples, there are case studies, but they are small and far between. And I think more evidence would be needed to see whether they are implementable at a wider scale and are plausible.
I'll just say that I think, as far back as Vitruvius, he was saying how we should design. And it's really going back to look how we lived often in places 100 years ago and using those technologies, and thinking now, how do we bring new materials to those basic principles? So kind of, again, recognizing your local wind, weather patterns, and trying to use local materials in ways that probably our fathers, mothers, parents knew better how to live with.
That addresses another question about traditional and existing cultural practices to address issues of heat, and that includes building practices. So we are almost out of time. I really thank the audience for wonderful questions. I really want to thank our panelists and the Center for Global Health Equity, and thank you everyone for joining us today.